So Dr. Nikunj will be talking about YouTube, and he's been extremely active. He shares a lot of surgical videos for training for residents as well. He shares YouTube videos for patient.
You've signed?
Yes.
Okay.
Dr. Gaurav also is not coming.
Gaurav is not coming.
He's not been able to come.
So,
Okay.
Rituja will be joining in a bit.
meanwhile, my presentation is just getting started. I'd like to thank Dr. Tushar for having me here.
I think they want
He's
you to
been a
sign
very good
twice.
friend, and we know each other since
okay,
our
okay.
training days from Narayan Netralaya. So I'll be talking about YouTube, what works and what doesn't. I'm currently practicing in Sarjan Netralaya in Indore. So what is YouTube basically? So YouTube is a platform where you can share videos. It's basically just for videos, and it is actually free to use and free to, if somebody wants to access some videos, that is also free for them. And currently there are like millions and probably billions of users who are active on YouTube. And it was launched in 2005, and then it was a very close group. There are few, I forgot the name, whoever invented it, and now it is taken over by Google, and that is being taken care of by Google right now. So YouTube is a very good platform. Why? Because it is free. If somebody wants to see some video about eye surgery, and if they have to pay to see that surgery, they will not be able to, they will not pay for it, just because if it is freely available on YouTube, obviously it can be shared freely, and they will also get the knowledge about what to do, what not to do. It can be anything. So it is important to share stuff on YouTube. So you can see that in India now, it has become a trend. People are becoming YouTuber as professionals, and we as a doctors, we cannot do that level kind of a YouTube thing, because our profession is different. We just want our patients to come through YouTube if somebody goes through a search and stuff like that. So if you can see that if somebody types eye care, there are a lot of videos. And actually what I found also, that the videos which are suggested by YouTube are not, very less by actually eye doctors. It's somebody who has got millions of followers, some guy who is talking about some eye care and some random drops, it is being shown. So it is also our responsibility that we share the right content on YouTube, and so that it can be helpful to patients as well. So how YouTube attracts the patients? So as I mentioned, that many of the patients try to search about cataract surgery, what are the types of cataract surgery, what are the different lenses after cataract surgery. The younger people who want to go for LASIK, ICL, or whatever refractive surgery, they always search on YouTube and come to us. In our practice, they always come and they say that I have seen a YouTube video about contour LASIK, right? This is very common to us nowadays. So what is contour LASIK? They start with that. They don't ask about LASIK, they ask about contour LASIK just because they have seen it on YouTube. So you can also share about your hospital facilities. An important thing is, if you have a few good patient testimonials who have taken treatment or done surgery at your place, and if they want to say something about your hospital or their experience, it is very important to share it on YouTube. And they will, because see, if when patient sees some other patient getting benefit from you, they will be a little bit more convinced that, yeah, if somebody else has got it, then obviously. Some patients think that doctors will always talk good about themselves, they will give, obviously showing good about their hospital. If some patient is saying that for you, then it makes a lot of difference. So just for basic, that how to upload a video. So you need to go to a page where there is an option of sharing the videos. It comes with that your YouTube channel. So you can upload a video, you can upload a new playlist, or you can upload even a podcast nowadays. So then after that, you have to go to select and select a file. Obviously you need to have a content ready in your laptop or in your mobile. You can do it from your mobile also, but I'm sharing here from the how to do it from your laptop. And then once you select the file from your laptop, it just goes there. Important thing is that you have to put a good title over here, and then put a description below. The description itself is your advertisement, because the title also has to be a catchy one, and because your title also explain to the patient that what this video is about, and the description will also have information related to your hospital, your details about your hospital website and numbers and stuff like that. There are a few other things which I have learned, using a YouTube, that there is a box below there. We have to put a tag. These tags are very important, because whatever you type, this becomes a keyword that your video is related to this. So you can type cornea, you can type retina, you can type eye care, you can type cataract surgery, whatever you type. So if somebody tries to search with those keywords, your video can be popped up as a result of the search what people have made about it, right? I think the resolution is not that great, if that's what I felt. Anyways, So, so these are the content what we are actually, doing. We are yet to go for the YouTube live question and answer, because that requires a lot of marketing, and you also have to be present at the time of that. But we are doing patient education videos, patient testimonials. We have made a video about hospital services taken care of by taking help of professionals. They have taken some drone view of hospital and stuff like that. And if you have a new machine or therapy, we also share that when we have some new machine. So this is just a short video of, we have made this short videos which is very good, that if you make once, it can be shared on Instagram, it can be shared on YouTube Reels, YouTube Shorts, Instagram Reels and stuff like that. So this is the video where I'm talking about what is cataract, just in a basic terms, and you have to make the language also patient friendly. It can be mix of Hindi, English or any local language wherever you are practicing, and talk about symptoms of cataract and just like that. It is just an example of what kind of video you can put. Important thing is that keep a background just like that you are also in an eye hospital, so you can see there's some small slit lamp half picture, and there is a screen showing eye picture as well. So these are just few things. It is basically suggested by our professional eye camera people and stuff like that, right? So another important thing is this thumbnail image. So thumbnail image is the short image which is visible when you do some search. So this image will represent that what your video is about. So this image you can actually make a different image which is not even part of the video and put it as a thumbnail image just to attract the patient. It can be a title, it can be your own photo, it can be your hospital's picture. Not necessarily that it has to be part of the content of the video, and that is also important because so many patients judge about the video just by looking at this thumbnail image. And one common mistake people do it is that if you have YouTube and if you don't share your YouTube content on other social media platforms, then it will not get circulated amongst people. So it is important to share your videos on Facebook, Instagram, Twitter, WhatsApp, or I also share on LinkedIn just for professional videos, surgical teaching videos and stuff like that. So it is very important to promote your content, not just putting out your YouTube is not always enough. So few of my friends also ask me that I don't have a YouTube channel, is it necessary, should I have it? I have Instagram, I have Facebook, I don't have YouTube. I would say yes and no. If you see, it is important to have your virtual presence in each and every platform if you have the liberty to it. And making a YouTube video it takes time, but if you are already having Instagram, Facebook and stuff like that, then obviously you can put those content, similar kind of videos on YouTube as well. So it just takes a little bit of extra effort. And obviously it is always better to have, because there is a chance that some patients only use YouTube, but then they might get information about you from YouTube as well, right? So now I'm talking about this is a very important thing which nobody has been able to crack it actually. So YouTube algorithm is a thing. So there is a YouTube AI which is created by Google people. So how the video works? So first of all, they look at the performance of the video. So whenever there's a new video, it has 0 views, right? So first you need to promote it on different medias and get some views. Once that the video gets some views, and if it is performing good and people are sharing it again, so it becomes like a chain reaction. You share it with somebody, then that person will share with another 10 people and stuff like that. And if that video is performing good and whatever keywords are there, then if somebody searches for those keywords, or suppose your name, or suppose your hospital's name, that video will be particularly suggested by YouTube as a suggested video on the right side of the screen, right? So important thing is and personalization, that whatever patient wants to know, your content is having the similar information what patient wants to know about. These are the factors which are related to your video content. There are certain user related factors also, like so what user is actually searching for, that is also important, and what type of topic user is used to seeing. So some patients are really into contour LASIK, then they will be looking for typing contour LASIK, LASIK, contour LASIK, something like that. So if your video also has that kind of content or keyword, then only it will be popped up to them. That is important, right? And there are like videos in the series, like there is one part of video and then there is a second part of video. So people generally watch it in one other, then followed by the second. Then YouTube itself will suggest to them that this is the next video people are watching in continuation. So so important thing is that if you need to have your YouTube channel at least enough that if somebody types your name and the video with your name and your face should pop up. Then only, I mean, you know, it will make sense. Because I know a few people who, even if they type their own name on YouTube, their content being shown is somebody else's. So that should not be the case, and you need to be actively, you know, putting stuff on YouTube to make sure that this happens. So another thing is your keyword search that I mentioned, that you need to keep your description, as we have kept this description that which contains our website and photograph for, detail about the appointment number and what the video is about LASIK and stuff like that. So what doesn't work is that if you have a poor title and content, obviously that will not, nobody will want to watch it. Yeah, it is important from YouTube criteria that if you use a copyright content sharing like music or some product, they will not be able to let you share your video or even block the video. And just putting it on YouTube and not sharing on other social media also doesn't work, right? And one thing is that very long videos or even a very short video will not work, because there has to be some content, at least 1 or 2 minutes, or at least 3-4 minute content just for patients to have some information and get attracted to what you are saying, right? So are you a YouTuber and ophthalmologist? But in current era, you have to be both. You have to, you know, balance everything. And it takes a lot of time, it takes efforts, but in this era, we have to do it. Thank you so much.
Excellent talk, Dr. Nikunj. So again, what happens a lot of times with us is, you know, we start posting on YouTube and we put in all the effort in making that one video, and we're wondering why is nobody watching it. So the issue there is the algorithm that he spoke about, that, you know, it's when you're posting consistently that YouTube starts believing in you and starts promoting your channel and starts showing you up on the feeds. So regular contents and the quality of content is extremely important.
Yes.
One thing I'd like to ask Dr. Nikunj is the cost involved. You said you get it professionally shot, right? So what is the cost involved, and how much should somebody spend?
We don't do it just for YouTube. We have a complete, you know, Instagram and stuff. They do all the things. So they are charging about, in Indore, they are charging about 13 to 14K per month for at least 5 reels in a month, something like that. So they will do the shoot and they will, you know, make the editing also, and make it according to your hospital logo and stuff like that, those kind of editing and some animations and stuff. So that is what the cost is around.
Can you post on YouTube without having your own YouTube channel? How do you get your own YouTube channel?
So that's what, that's a good point. So actually, you need to have a Google account, basically. Right, so those Google account, everybody, I think, if you're an Android user, you need to have a Google account. Similarly, if you have a Google account, you can create your own YouTube channel. And first, when you create a YouTube channel, you need to put your name of the YouTube channel, you know, put a logo or put a photograph of your hospital or whatever the type of YouTube channel you want to you are making. And I think that should be enough for a, you know, YouTube account to be created. Just Google email address is good enough.
Okay.